Yes, so sorry for the interruption. Um, so we're talking about the vertebral osteomyelitis, that is bone infection. Yes, so there was a little hiccups. Yes, and so the vertebral osteomyelitis, that is bone infection that's at the back. So when you have the backbone infection, so at your back, you have bones at your back. So if they have the bones being infected at the back, you could have vertebral osteomyelitis. Is one type of osteomyelitis, that's a bone infection. The first one we talked about was diabetes related osteomyelitis. That's when you have diabetes, you could have infection in your bone as a result of diabetes. And the second one is the vertebral osteomyelitis, that is the bone infection at your back, the backbones being infected. And so the prevalence increase with age. So as the person grows older, for about 70 years, we have a higher prevalence because they have a weakened immune system. So it's shown that there's high mortality, that people died as a result of vertebral osteomyelitis, because of other conditions also that came along with it. So how can we notice this condition called vertebral osteomyelitis? We have characteristics of this condition. So when someone has this condition called osteomyelitis, yes, how do we notice that someone has it? First of all, one, the person has pain around the affected regions of the body, or tenderness. When you say tenderness, when you touch the place feels a bit soft, and the place feels a bit indifferent from the other part of the body. Okay, so the person actually complains of pain around that side. So if the person has back pain, so someone who has back pain doesn't really mean that the person just has pain at the back, or the bones are not so strong, but it could be infection at the back. So we take a very good assessment of the condition or the complaint before then we give the treatment, because if you don't do a very good assessment, yes, you can't get a better treatment. Okay, so aside pain, there could be inflammation. That is, you could have swelling around the side, there could be redness, and there could be warmth. The place, when you touch the place feels a bit warm, and then when you touch the place, you feel like quite warm or a little bit hot. Yes, and then also the person also feels like vomiting. The person has nausea, and then generally the person feels ill, because in fact when the infection attacks the back or the bones, it actually affects the whole body, including the brain, because there is discomfort in the person. The person feels ill at the time of infection. Also, the person complains of low back pain, that is in terms of the vertebral osteomyelitis. Yes, the person could have also swelling in the legs, in the ankles, and the feet. In the feet, yes. So these are some of the signs that you could see that the person has osteomyelitis, be it diabetes related or vertebral osteomyelitis or other types. The person also could have joint pain. So the affected body parts could present with joint pain. You could have it in the feet, and when you have feet in the pains in the ankles, or joint pains around the ankle regions, or the lower back in the joints, or the elbow or the wrists, or the other body parts. And also the person could have reducing function. So if it's the wrist, the person cannot lift things very very well. If it's the ankle, the person cannot walk well. The person walks in a limping mode, so the person begins to limp as the person walks. And also the person has fever. The person could have fever, the person could have general body weakness and swelling around the body part, the affected body part. The person could have antalgic gait. When you say antalgic gait, it means the person limbs as the person is walking, and this is as a result of infection in the bones. Okay, and one very important point we should note is that we could have primary osteomyelitis and we have secondary osteomyelitis. Actually, the primary type is actually manifested in both children and adults. Yes, and then it will depend on the level of the infection. So it could affect children and could affect adults. For the children's type, it tends to be more acute than chronic, because then the children have a very good tendency of recovering as best as possible, than an adult who has an immune system which is a little bit compromised, and then very difficult to bring back to the normal strength. Okay, so for children, it could be between the weeks of 2 weeks, yes, 2 weeks, and could have osteomyelitis. The person could have actually a pre-existing condition, pre-existing infection of the body. And one important microorganism is the Staphylococcus aureus. We've mentioned it in the previous seconds or minutes ago. And the person could also have, a child could have high fever, and then this could be as a result of infection of the bone called osteomyelitis. And in some cases also, we have other presentations of the child. The person could have tenderness, the person could have swelling around the body parts. For adults, the adults tend to have subacute, that is more than 3 weeks, or getting 3 months, or 3 months, 6 months, even years, and of this pain, this tenderness, this swelling, and then it could be very, very discomforting, Other likely cause of this condition could be as a result of trauma. So where you've hit a part of the body, that is, in older people, if you have frequent or consistent falls, there could be injuries, or there could be fractures that could cause infection around that region, and it could have osteomyelitis, or the bone infection, or infection in the bones. Okay, so when we look at some further causes of this condition, we could have other organisms we've mentioned earlier on. One of the boss causes, that is Staphylococcus aureus. Yes, this is very stubborn. It's able to attack the immune system, and when you're even taking antibiotics, sometimes the antibiotics is not able to really destroy the whole host, or the host of the system, and so therefore they're able to resist the antibiotics. So medical practitioners tend to give it, or to prescribe a stronger antibiotic to be able to fight this Staphylococcus aureus. So other organisms also that could cause infection in the bones, we could have Pseudomonas, we could have Klebsiella, we have Salmonella. These are all scientific names. We have Escherichia coli. These are all organisms that will cause infection in the bone. And then, as we mentioned earlier on, it could affect so many areas in the body. It could affect the ankle, the knees, the elbow, the back, yes, the feet, so many areas in the body. And so far as it's habitable for the organism, that is the microorganism, it could affect the microorganism. And also affects different types of people. It's irrespective of the people, irrespective of the person. So far, so immune system, which is very, very key component, is compromised, it could be infected by this condition called osteomyelitis. Okay, so other researchers stated that also that the vertebral osteomyelitis, that's the one that affects the bone, the back region, most adults are affected by this type of osteomyelitis, that the vertebral osteomyelitis. Most adults are affected. And also another study also stated that once the particular components of the bone, that is, we have a structure we call the cartilage. So in between two bones, we have a cartilage which helps prevent the impact of two bones together. That is allowing to prevent friction. That is them wearing away each other. We have something we call cartilage, and this cartilage helps to give a very good movement between bones. And so when this cartilage is infected by this organism, this will also result in osteomyelitis. Therefore, it could also transfer this infection to the bone, and this will cause osteomyelitis, that is bone infection. This could be as a result of stimulation of something we call endotoxins. It's a scientific term, and this could cause a release of these toxins, and this could infect the bone and cause osteomyelitis. We have other organisms that also could cause osteomyelitis. We have the Pseudomonas, we have the Haemophilus influenza, we have the Escherichia coli, which we mentioned earlier on, and these are all capable of causing infection in the bone, and this will cause osteomyelitis or bone infection. Okay. So it's very, very important that we take notice of these likely causes of osteomyelitis. Okay, so we look at you mentioned that aside the medical management, aside the physical management, we have surgical management also, which are very important to be able to treat this condition. Surgical procedures are very important because sometimes when you do all the therapy, especially to the bone and it's infected, you can't do anything. But then you have to take off that particular side because when it's infection can spread throughout the whole body, and so we have to curtail that. We have to control the infection in a particular. If it's your hand and your wrist is infected, you have to cut off your hand so that the infection in the wrist doesn't spread throughout your body into your heart, because when immediately your heart is affected by the infection, it could cause you to die. Yes, and we want to prevent death, so we have to cut off that particular part of the body to allow the infection to stop spreading. So we have implanted devices that also helps to control the rate of infection. We have another type of infection we call the bone infection called exogenous osteomyelitis. That is where we have the bone coming out. So in case you are sitting on a motorbike and then you fall down, the bone comes out. The bone can be infected by the environment, that is the floor there, and it could cause osteomyelitis or bone infection. And then very important, you have to talk about immune system. So if your immune system is compromised, you don't eat well, you could have osteomyelitis because your bones can be exposed to infection. And so let's take note that we have to eat well, eat a balanced diet, and then we are free from osteomyelitis. Also, we have something we call also, aside the vertebral, the diabetes related, we also have something called hematogenous osteomyelitis. Actually, this one is acquired from the spread of organisms from pre-existing infections such as boils, the persistent boils that we have found. The scientific name is furunculosis. If you have a lot of boils, the boils under your armpits, boils everywhere, this will cause your bones to be infected and then resulting in osteomyelitis. If you have also respiratory infections, if you have infections in your teeth, if you have sinus infections that's in your ears, you could have osteomyelitis. You can be predisposed to have osteomyelitis. Also, how can we diagnose this condition? We have actually this condition is actually difficult to diagnose because you have to go to take blood tests, and then just the symptoms can look like other conditions. So we go to take blood tests whether there's infection in the blood, and then this could also help us. It's also actually a very important key note that when through blood tests, we can have us identify the infection or the infectious organism or a microorganism to be able to treat the condition as best as possible. So the signs and symptoms also helps us to be able to treat the condition very, very well. Aside that, we could, if it's the vertebral type of osteomyelitis, that's the osteomyelitis that affects the bone, the backbone, we can check an MRI. You can see the misalignment or the degeneration of the bones around the side, and this could also help us to be able to see and diagnose this condition. Actually, the bones will not show any sign of abnormality within 10 days, but after 10 days the infectious organism attacks the bones and causes destruction of the bones. And so after 10 days you could see the signs of infection in the bone through the MRI, through X-ray, through a type of scan called fluorine 18 flow deoxyglucose positron emission tomography. It's a big word myself, I'm struggling to mention it, but these are all tests that helps us to diagnose this condition called osteomyelitis or bone infection. So aside the tests, also we also have medical management. So we also take antibiotics, as we mentioned earlier on. Within the first 4 to 6 weeks, that's the acute stage. Antibiotics helps a lot to be able to resist further infection and causes the infection to become chronic. Okay. Also, we have procedures called draining the infected area, and these are also moving necrotic bone and soft tissue. We have debridement, which can be done to be able to reduce infection rate. Also, restoring normal blood flow to the bone, to exercise, to medication. The medication that we take in to be able to open up the blood vessels so that we can have enough nutrients and also resist infection. And then also we have the extreme part, that's the amputation. That's when we mentioned earlier on, we cut off the particular part of the body to prevent further spread of infection to the other parts of the body. Aside the medical management, we also have the physical therapy management. Actually, the physical therapy management depends on the diagnosis of the condition. So if the condition is diagnosed, we also take caution in terms of, if it's the back, we have other therapy. We have warm therapy, or we have gentle exercises to ensure that the place doesn't get stiff, and also we ensure we engage in gradual progressive exercises to bring strength to the bone, and also to ensure that there's enough blood to the bone to ensure the person functions very well. The other complication that could result if we have osteomyelitis, and it's very, 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 very important that we take notice, because if the body is infected, it could cause infection into other parts of the body. You could have infection in the lungs, because when you don't control the infection through medication, through early medication, it could also cause other complications to your lungs, to your liver, to your kidney, so many conditions. So early treatment is very, very key for good recovery. And also we have to eat well. So I'm sure my fellow dietitians will understand me that it's very, very important that we have to eat well to ensure that we have a good immune system, because a compromised immune system could expose us to have bone infection or osteomyelitis. It's very important. So aside this, we have other conditions that could look like osteomyelitis. I'm sure when I mentioned them, they're a bit big, but let's take it like that. We can read upon them and then get to know upon them. We have the Aries Sarcoma. So we have, that is a form of cancer, and this could look like this condition called osteomyelitis. But through various investigations, we can rule out this condition and then further diagnose this condition called osteomyelitis. We also have reactive bone marrow edema. We also have traumatic stress fractures. We also have inflammatory arthritis. We also have gout. That's infection of the big toe. So if the big toe is the only one infected, we have other tests. We've talked about gout some time ago. So if you want to read on gout, or you want to know more about gout, you can just search this on Facebook about gout on my Facebook wall. I'm sure you see a very extensive discussion on gout of this condition. Or if you want a request, you can just PM me. You can private mail me, and I can send you the link to watch on gout. Yes, thank you. Okay, so a case study also was carried out among hockey players, and they realized that although hockey players also are likely to have other conditions, this condition called osteomyelitis also had a relatively high prevalence, that is, had a likelihood of being associated with these people called hockey players, and actually they presented with unexplained acute back pain. That is, within the first day and in 3 weeks they had acute back pain. That they had a high level of back pain. So they tend to have this type of osteomyelitis that we discussed earlier on, the vertebral osteomyelitis. Okay, there has been so many researches that have been carried out, and I'm sure if we take a very good interest in this topic, we can learn a lot, we can read a lot on the net. Okay, so I'm sure we've come to the end of our discussion, but before we leave, we look at some pictures as usual of this condition. Yes, and then we can have a fair idea of this condition. Okay, so this is what we're talking about, osteomyelitis. Yes, so it affects actually the bones. So you can see, if you compare the two, you can see this bone, this is a leg bone, you have the tibia and fibula. This is the normal bone. You can see how whitish it is. But if you compare these two, you can see that this one has lost its whitish nature. There's some darkened portion around this region. Yes, you have this darkened portion around this region, and you can see it's not so whitish as this one. And this could give through the X-ray we can say the person is likely to have osteomyelitis, but other tests, that is lab tests, can confirm the occurrence or the incidence of osteomyelitis. This is also the leg bone. You can see the red sign that shows the infected area, yes, of osteomyelitis. You can have the knee. Yeah, this is an MRI, a very good MRI that shows the infection. You can see it here. You can see how darkish it is. Okay, so this is also an example of osteomyelitis. You can see the greenish region here indicating osteomyelitis. Okay, and so these are some of the symptoms that someone who has osteomyelitis will present. As we mentioned earlier on, fever and chills, redness and swelling in the affected area. We have lack of energy. The person gets tired easily, which is scientifically called malaise. And then the person has irritability. The person gets annoyed easily. The person becomes uncomfortable. And also, you can see this is a very typical presentation of this condition called osteomyelitis. You can see the infected area looking a bit bruises. Okay, so this is an example, an extensive description of this condition. Yes, okay, so this is an MRI. You can see the back here this bone looks very inconsistent. You can see the darkened area, so this region of the bone looks not so whitish, and this could infer osteomyelitis presence. So you can see the bacterial infections. You can see the person has swelling around the side. This is a typical example of the vertebral osteomyelitis in children. Vertebral osteomyelitis in children. So you can see it from this angle. Vertebral osteomyelitis in children. You can see it, the child. And then also in the toes, you can see it here by bacterial infection. Okay, and this is the hip region. Osteomyelitis in the hip region. I'm sure you can see it very extensively. This is the toes. This is the back in a child who has vertebral osteomyelitis. Okay, this is also the hand. You can see the this is called the radius. You can see the radius bone is very unwhitish. So you can see the osteomyelitis of the bone here. Another example. You can see the bone here, osteomyelitis. You can see this gives an extensive description of the condition osteomyelitis too. Okay, so some pictures, yeah, more pictures. These are the surgery carried out by someone who has weak bones. So the person has a weak leg bone being affected, so the surgery has been carried out to be able to treat this condition. The person broke the bone, had a fracture of the bone, and then the surgery was carried out to put implants to be able to stabilize the bone, and then it was infected. So therefore they are protecting the bone very, very extensively to allow the bone to heal very well. So this is another picture of the bone. Okay, so very well said. I'm sure we've learned a lot this evening, and I'm sure we'll be able to give a very good account of this condition called osteomyelitis to anyone. And you can log on to the YouTube page, which will be shown to you very soon, and then watch other previous videos, previous discussions, previous health condition, and I'm sure we'll have a lot to learn from. Okay, so without much ado, if you have any question, I'm sure I saw people coming in and going out. Yes, and I thank you for your time. Okay, I can see Abdul Eskandari. I can see other people coming to join in. Yes, so thank you very much for your time. I'm very grateful. We bless God for a successful presentation. And so our next topic and so today is 11th, so next week will be 18th of April. Our next topic will be a very interesting topic. Yes, I'm sure you'll be very, very keen. And so when we see the flyers, let's all share, and then let's share the link so that we all watch. And then our previous slides, our previous videos too, we can share them to our loved ones to watch. Okay, so our next topic for discussion is a condition called spondylolisthesis. Spondylolisthesis is a I don't want to talk about this. Yes, we'll talk about it next week. And so it's also presents itself with back pain. Yes, back pain. And so we'll talk about it and announce in this discussion. So thank you very much for your time. May the good Lord be with us. So have a blessed evening, have a wonderful week, and see you next week. Take care. Bye.